What if I told you that an ancient remedy used for thousands of years across multiple civilizations could dramatically improve blood flow, enhance tissue health, reduce inflammation, and support optimal function in areas of the male body that most men are too embarrassed to discuss with their doctors? I am Dr. Sofia Carter, and throughout my career in integrative urology, I have witnessed countless men struggling with declining circulation, reduced sensitivity, tissue changes, and diminishing physical response in the most intimate areas, often accepting these problems as inevitable consequences of aging when in fact they represent correctable issues that respond remarkably well to targeted topical interventions. What I am about to share may sound unconventional to those accustomed to thinking that every health problem requires a pharmaceutical solution, but the traditional use of castor oil for supporting male genital health has been practiced for millennia, and modern research is now revealing the sophisticated biochemical mechanisms that explain why this simple, natural substance produces such profound effects. Castor oil is not just some folk remedy based on wishful thinking. It is a therapeutically active substance with unique properties that make it extraordinarily effective for improving tissue health, enhancing local circulation, reducing inflammatory processes, supporting cellular regeneration, and creating optimal conditions for the delicate tissues involved in male function to maintain their vitality and responsiveness. The transformations that men experience when they begin using castor oil properly and consistently often include improved firmness and quality of physical response, enhanced sensitivity and pleasurable sensation, better tissue appearance and health, reduced discomfort or functional concerns, and a profound restoration of confidence in their physical capabilities. Before I explain exactly how to use castor oil for maximum benefit and safety, you need to understand what castor oil actually is, why it possesses such remarkable therapeutic properties, and the specific mechanisms through which it affects tissue health and function in the male genital region. Castor oil is extracted from the seeds of the castor plant, scientifically known as Ricinus communis, which has been cultivated for medicinal purposes for over 4,000 years across ancient Egypt, India, China, and numerous other cultures. The oil is composed primarily of ricinoleic acid, a unique fatty acid that comprises approximately 90% of castor oil's composition and that is found in virtually no other natural substance in such concentrated amounts. Ricinoleic acid possesses extraordinary anti-inflammatory properties that have been validated through modern scientific research. When applied topically to tissues, ricinoleic acid penetrates deeply and exerts powerful effects on inflammatory signaling pathways, reducing the production of pro-inflammatory cytokines and prostaglandins that cause tissue damage, impair circulation, and interfere with normal physiological function. Chronic low-grade inflammation in genital tissues is far more common than most men realize and contributes significantly to declining function, reduced sensitivity, tissue changes, and progressive deterioration of vascular responsiveness. By powerfully suppressing this inflammatory activity, castor oil creates conditions where tissues can heal, regenerate, and function optimally. The second critical property of castor oil is its remarkable ability to enhance local circulation and blood flow to the tissues where it is applied. The mechanisms involve both direct effects on blood vessels and indirect effects through reduced inflammation. Ricinoleic acid appears to promote vasodilation, causing the small blood vessels and capillaries in the treated area to relax and expand, allowing increased blood volume to flow through with reduced resistance. Enhanced local circulation delivers more oxygen and nutrients to tissues, supports cellular metabolism and energy production, facilitates removal of metabolic waste products, and promotes tissue repair and regeneration. For the specialized tissues involved in male physical function, which absolutely depend on adequate blood flow for proper response and sustained capability, this circulation-enhancing effect is transformative. The third important property is castor oil's penetrating ability. Unlike many topical substances that remain primarily on the skin surface, castor oil has an unusual capacity to penetrate deeply into underlying tissues, carrying its therapeutic compounds into the dermis and even into deeper structures. This deep penetration allows castor oil to affect not just superficial skin, but the actual erectile tissues, blood vessels, nerves, and other structures that determine physical function and response. The oil essentially delivers anti-inflammatory and circulation-enhancing compounds directly to the tissues that need them most. The fourth valuable property is castor oil's effect on lymphatic circulation. The lymphatic system is a crucial but often overlooked component of tissue health, responsible for removing cellular debris, inflammatory compounds, excess fluids, and toxins from tissues. Poor lymphatic drainage contributes to tissue congestion, inflammation, reduced function, and various uncomfortable conditions. Castor oil has been shown to enhance lymphatic flow and drainage, helping clear accumulated inflammatory materials and creating healthier tissue conditions. This lymphatic stimulation is one reason why castor oil packs have been used traditionally for reducing swelling and inflammation throughout the body. Now let me address what happens specifically when castor oil is applied to male genital tissues. The first and most immediately noticeable effect for many men is improved tissue quality and appearance. The skin of the genital area can become dry, discolored, less elastic, or develop various benign changes over time due to aging, friction, inadequate circulation, or inflammatory processes. Regular castor oil application improves skin hydration, enhances elasticity, promotes more uniform pigmentation, and generally creates healthier-looking tissue. While this might seem purely cosmetic, it actually reflects genuine improvements in underlying tissue health and cellular function. The second significant effect is enhanced sensitivity and nerve function. The nerves in genital tissues require adequate blood flow and healthy surrounding tissue conditions to function optimally. Inflammation, poor circulation, and tissue damage can all impair nerve signaling and reduce sensitivity, which directly affects the quality of physical sensation and pleasurable response. By improving circulation, reducing inflammation, and supporting overall tissue health, castor oil helps restore and maintain optimal nerve function. Many men report that they notice enhanced sensitivity and more intense pleasurable sensations after several weeks of consistent castor oil use. The third important effect is on the vascular structures within erectile tissues. The ability to achieve and maintain firm physical response depends entirely on the capacity of specialized vascular chambers within the genital anatomy to rapidly fill with blood and maintain that engorgement. The smooth muscle cells, endothelial cells, and connective tissue structures that comprise these chambers require optimal health to function properly. Inflammatory damage, fibrosis, reduced elasticity, and impaired cellular function all compromise erectile capability. Castor oil's anti-inflammatory effects, circulation enhancement, and tissue regeneration support help maintain the health and function of these critical structures. Some research and clinical observations suggest that regular castor oil application may help reduce fibrotic changes in erectile tissues. Fibrosis is the formation of excess fibrous connective tissue, similar to scar tissue, which can occur in erectile chambers due to aging, inflammation, reduced blood flow, or various injuries. This fibrotic tissue is less elastic and less capable of the expansion necessary for optimal physical response. The anti-inflammatory and tissue healing properties of castor oil may help prevent progression of fibrosis and possibly even reverse some existing fibrotic changes, though more research is needed to fully validate this effect. Another significant benefit reported by many men is reduction in various minor discomforts or functional concerns that can develop in genital tissues. Issues like mild discomfort, reduced flexibility, tissue changes, or functional limitations that men often hesitate to discuss with healthcare providers frequently respond very well to regular castor oil application. While I always recommend consulting with a urologist for any persistent concerns, many benign issues resolve or improve significantly with this simple intervention. Now let me explain exactly how to use castor oil properly for maximum benefit and safety. First, you must use high-quality, pure, cold-pressed, hexane-free castor oil. The quality of castor oil varies dramatically, and lower-quality oils may contain residues from chemical extraction processes or may have degraded therapeutic compounds. Look for organic, cold-pressed castor oil specifically labeled as suitable for therapeutic use. The oil should be stored in a dark glass bottle away from heat and light to preserve its therapeutic properties. The application protocol is straightforward, but requires consistency for optimal results. Begin by ensuring the area is clean and dry. Take a small amount of castor oil, approximately 1/2 to 1 teaspoon, and warm it slightly by rubbing between your palms. This makes the oil less viscous and easier to apply. Gently massage the oil into the skin and tissues of the entire genital area, including all relevant anatomical structures. Use gentle circular motions and apply enough pressure to work the oil into the tissues without causing any discomfort. Spend approximately 5 to 10 minutes on this massage, which not only ensures thorough oil penetration, but also provides additional circulation benefits through the mechanical stimulation of massage itself. The optimal timing for application is before bed, allowing the oil to remain in contact with tissues for many hours overnight without interference. After massaging the oil in thoroughly, you can either leave it uncovered if sleeping alone or wear comfortable, breathable cotton underwear to prevent oil transfer to bedding. Some men prefer to place a soft towel on the bed for the first few nights until they determine how their body absorbs the oil. Most men find that after the initial massage and absorption period, very little oil transfers to clothing or bedding. For maximum therapeutic effect, many practitioners recommend also applying a castor oil pack to the lower abdomen and pelvic region. To create a castor oil pack, saturate a piece of clean flannel cloth with castor oil, place it over your lower abdomen, cover with plastic wrap to prevent oil transfer, and apply gentle heat using a heating pad or hot water bottle for 30 to 60 minutes. This drives the oil's therapeutic compounds deeper into tissues and enhances circulation throughout the entire pelvic region, supporting not just genital tissues, but also the prostate and other pelvic structures. The castor oil pack can be done 2 to 3 times weekly in addition to the direct genital application. The frequency of direct application can vary based on individual needs and response. For general maintenance and prevention, 3 to 4 applications per week is typically sufficient. For men addressing specific concerns or seeking more intensive therapeutic effects, nightly application for several weeks or months may be appropriate. Most men notice initial improvements in tissue quality and comfort within 1 to 2 weeks, with more significant effects on function and sensitivity emerging over 4 to 8 weeks of consistent use. I need to address some important safety considerations and potential concerns. First, castor oil is extremely safe for topical use and has been applied to skin throughout the body, including sensitive areas, for thousands of years across countless cultures. Allergic reactions are extremely rare but theoretically possible, so if you have very sensitive skin or known allergies, you might want to test a small amount on your inner forearm for 24 hours before applying to genital tissues. Second, castor oil should not be applied to broken skin, open wounds, or active infections. If any cuts, abrasions, or infections are present, allow them to heal completely before beginning castor oil application. Third, while castor oil is safe, it is quite thick and can be messy, so some preparation and planning around application is worthwhile. Many men find that establishing a routine, such as applying the oil right before bed after their evening shower, makes the practice sustainable and easy to maintain. Fourth, castor oil should not be used as a lubricant for intimate activity. While it is safe for external tissue application, it can damage latex barriers and is not appropriate for internal use. Use proper water-based or silicone-based products designed specifically for intimate activity. Some men wonder whether internal consumption of castor oil provides similar benefits. Castor oil has traditionally been used as a powerful laxative when taken internally, but this use is entirely separate from the topical application we are discussing. The therapeutic effects for genital tissue health come specifically from topical application, and internal consumption is not necessary and not recommended as part of this protocol. The mechanism of enhanced blood flow from castor oil application deserves additional explanation because it is so critical to the benefits men experience. When castor oil is massaged into genital tissues, the ricinoleic acid penetrates and causes local release of nitric oxide, the primary signaling molecule that triggers vasodilation throughout the cardiovascular system. This locally produced nitric oxide causes the small arteries, arterioles, and capillaries in the treated tissues to relax and expand, allowing dramatically increased blood flow. This enhanced circulation delivers more oxygen to cells, supports energy production, facilitates waste removal, and provides the volumetric blood flow necessary for optimal physical response. Additionally, the anti-inflammatory effects of castor oil help restore normal endothelial function in blood vessels. The endothelium is the delicate cellular lining inside blood vessels that produces nitric oxide and regulates vascular tone. Inflammation damages endothelial cells and impairs their ability to produce nitric oxide and respond to signals for vasodilation. By reducing inflammation, castor oil helps restore healthy endothelial function, which improves circulation not just during the time the oil is present, but progressively over time as tissue health improves. The lymphatic drainage enhancement is another crucial mechanism. The lymphatic system has no pump like the heart for the circulatory system, relying instead on muscle contractions and external pressure to move lymph fluid through vessels. When lymphatic flow is sluggish, tissues become congested with inflammatory compounds, cellular debris, and excess fluid, creating swelling, discomfort, and impaired function. The massage application of castor oil combined with the oil's inherent lymphatic stimulating properties helps mobilize stagnant lymph, clear congested tissues, and restore healthy fluid balance. This is why some men notice slight temporary swelling or increased urination in the first few days of castor oil use as accumulated fluids are mobilized and eliminated. For men dealing with specific urological concerns, castor oil can be a valuable complementary intervention alongside conventional medical treatment. For example, men with mild prostate concerns often benefit from castor oil packs over the lower abdomen, which may help reduce inflammation in prostate tissues and improve pelvic circulation. Men with mild circulatory issues affecting function often experience significant improvements from the enhanced local blood flow that castor oil promotes. Men with tissue changes or minor anatomical concerns frequently find that tissue quality improves substantially with consistent use. It is worth noting that the benefits of castor oil application extend beyond just physical function and tissue health. Many men report psychological benefits, including reduced anxiety about physical capability, increased confidence in intimate situations, improved body image regarding genital appearance, and enhanced overall sense of masculine vitality. These psychological benefits should not be dismissed as merely placebo effects because they represent genuine improvements in well-being and quality of life that matter deeply to men experiencing them. The historical use of castor oil across diverse medical traditions lends additional credibility to its therapeutic applications. Ancient Egyptian medical texts describe castor oil for various healing purposes. Traditional Chinese medicine incorporated castor oil for improving circulation and resolving stagnation. Ayurvedic medicine from India used castor oil extensively for tissue healing and rejuvenation. European and American folk medicine traditions employed castor oil packs for reducing inflammation and supporting healing throughout the body. This convergence of traditional wisdom across cultures separated by geography and time suggests genuine therapeutic efficacy that modern research is now beginning to validate scientifically. Some practitioners recommend enhancing castor oil's effects by combining it with essential oils that have complementary therapeutic properties. A few drops of lavender essential oil can provide additional anti-inflammatory benefits and create a pleasant scent. Frankincense essential oil has been studied for supporting tissue regeneration and cellular health. Sandalwood oil has traditional use for male reproductive health and provides calming aromatherapeutic benefits. If adding essential oils, ensure they are therapeutic grade and appropriately diluted, typically no more than 2 to 3 drops per tablespoon of castor oil, as essential oils are extremely concentrated and can cause irritation if used in excessive amounts. The cost of implementing castor oil therapy is remarkably minimal. A single bottle of high-quality organic castor oil typically costs between $10 and $20 and lasts several months with regular use. Compared to pharmaceutical interventions, specialty supplements, or medical procedures, castor oil represents an extraordinarily cost-effective approach to supporting genital tissue health and function. The accessibility of castor oil, available at virtually any health food store and many pharmacies, means that any man can easily try this intervention without requiring prescriptions, medical appointments, or significant financial investment. For men who are skeptical about whether such a simple intervention could produce meaningful results, I encourage approaching this with an open mind and a commitment to consistency. Give the practice a genuine trial of at least 8 to 12 weeks with regular application before judging effectiveness. Document your starting point in terms of tissue quality, sensitivity, functional capability, and any specific concerns, then objectively assess changes over time. Many men are genuinely surprised by the improvements they experience, having expected at most marginal benefits, but finding instead substantial enhancement in multiple aspects of tissue health and function. In conclusion, the topical application of high-quality castor oil to male genital tissues represents a safe, natural, scientifically grounded approach to supporting tissue health, enhancing circulation, reducing inflammation, and maintaining optimal function. The unique properties of ricinoleic acid create powerful therapeutic effects that address multiple pathways of tissue aging and functional decline simultaneously. For men seeking to preserve or restore the health, sensitivity, and capability of these crucial tissues, castor oil offers a practical and remarkably effective solution. Thank you for your attention. I am Dr. Sofia Carter. If you found this valuable, please subscribe for more evidence-based health content. Here is to your vitality and tissue health.